Hello and welcome to Talking Change's Antenatal Anxiety Workshop. My name is Tamsin Rowe. I'm a cognitive behavioural therapist here within Talking Change, and I have a special interest in perinatal mental health.
My name's Rochelle Brown. I'm a Psychological Wellbeing Practitioner here at Talking Change, and again I also have a special interest in perinatal mental health as well.
So who is this workshop aimed at? So it's aimed at women who are currently pregnant and anxious and interested in learning some simple strategies for managing anxiety. So you may or may not be aware that up to 1 in 5 women struggle with their mental health during the first year of a child's life, with half of those cases starting during pregnancy. And here in Portsmouth, we have over 200 new mums a month. So that's a lot of women who are struggling with their mental health during pregnancy and in the first year after birth. What we also know is that due to the pandemic, that's significantly increased. So we wanted to put together this workshop in order to teach you some rough and ready strategies to try and manage some of that anxiety that you're experiencing. And as part of that, pregnant women in the UK were placed in the vulnerable category by the UK government back in March of 2020. So this, along with all the other difficulties that's brought up by COVID-19, such as changes to your care, can understandably lead us to feeling extremely anxious.
So a bit about who we are as a service. So Talking Change is a primary care mental health service based in Portsmouth, and it's provided by Solent NHS. So within our team, we have a mixture of therapists and researchers who specialise in understanding the treatment of those common mental health problems, such as depression and anxiety. So it's a service there for you, and it's free of charge as part of the NHS if you're struggling with low mood or anxiety during pregnancy or after birth, or if you have any physical conditions such as pain or fatigue. We're here to offer some talking therapies to really help you manage and get sort of that meaning back to life and help you cope and feel better. As I mentioned, it is a free service and it's completely confidential as well.
So what services we provide? So I'm really proud of this slide because I managed, for the most part, to avoid using any acronyms. But it's just to say that we can provide therapy one-to-one, we can do it in a group, and since shutdown in March, we've moved completely remotely. So we are completely open and fully functioning. We are now offering sessions by phone, video call, or online. So we have an online program called Silver Cloud. So we offer a variety of therapies, and as I say, we are fully open and fully functioning as a service. We're just not currently doing any in-person therapy, and obviously we'll keep that under review as and when the restrictions come out. So depending on the type of therapy offered, we will see you for between 6 sessions or 12 sessions. So in Rochelle's role, she'll tend to see people for 4 to 6 sessions, and that will be for about 30 minutes each week. I tend to see people with perhaps more moderate to severe difficulties, so I see people for a little bit longer because we need a little bit more time to go into difficulties. So we'll offer sessions which are between 50 to 60 minutes on a weekly basis, and that will be up to 12 sessions. And those sessions are the same time every week. So these are all the different therapies we offer. So these are the ones which have millions of acronyms. So we offer CBT predominantly, as it says there, where is the recommended treatment for anxiety disorders. So we predominantly offer CBT, but we also offer, deep breath, we offer counselling, mindfulness-based cognitive behavioural therapy. We offer compassion-focused therapy, acceptance commitment therapy, eye movement desensitization and reprocessing therapy, narrative exposure therapy, interpersonal therapy, dynamic interpersonal therapy, and couples therapy.
Wow.
You don't have to, yeah, I know, right? But we don't have to, you don't have to know which one's going to be right for you, because that's what we offer. We offer an assessment process, and we can then talk you through which one of them is going to be perhaps most helpful given your difficulties. So if you've ever heard of EMDR or ACT or CFT, those are some of the acronyms that might be to do with the therapies that we can offer.
So As Tamsin said, we predominantly offer CBT, as that's what the evidence suggests is one of the most effective things for supporting people with depression or anxiety. And the bread and butter of CBT is what it really says in the title. It's cognitive behavioural therapy. So cognitions is that fancy word for thoughts, our cognitions. Our behaviour is what we do, and therapy is how we feel, changing how we feel. So we look at all them elements and look at what we think and what we do, how it affects our feelings. So we look at making some key changes in areas we do have control over. So ultimately it has a positive effect on our feelings. So we look at various different vehicles all the time. But yeah, that's the main aspect of how we work and how we help people overcome their difficulties.
We always say that if it was simple as somebody saying to you, oh, just snap out of it, just stop feeling anxious. If it were that easy, we'd have done it by now. But it might be that perhaps, is there anything that I'm doing or any kind of behaviour I'm undertaking which perhaps isn't actually helping? So maybe in the short term it helps, but in the long term it makes me feel worse. Or is there a particular way I'm looking at this situation that isn't necessarily helping me? And we'll go into that in more detail. And if you have sessions with us, you'll be very, very familiar with this format by the end of your time with us, because it really does form the foundation of everything that we talk about together in CBT.
And remember, it's not up to you guys to have to know what we do or how we act, how we react in certain ways. That's what we're there for, to be able to help you identify and recognise whether what we do is helpful or unhelpful, and whether we can make some key changes.
Definitely. So we've said that this is aimed at people who are feeling anxious, but actually it's really important to go down to basics and say, well, hang on a minute, what is anxiety? So anxiety and fear are the normal, natural responses to any challenging situation infused with danger and uncertainty. So anxiety is normal. Particularly if we're faced with uncertainty, so particularly in times of crisis like, a global pandemic, for example, any sort of fear and anxiety is inevitable and completely normal. And it's just to say that being pregnant can be quite an anxiety-provoking time. There's lots of kind of what-if thoughts anyway, but to think about putting that in the context of a pandemic is even more anxiety-provoking. So although it might feel really uncomfortable, and we'll come on to talking about what kind of the physical symptoms you might be experiencing as a result of this anxiety, it is normal, and perhaps actually it might not be in proportion to the threat, and that's when we talk about ways to manage that. So the first thing to say is to normalise it, to say actually anxiety is normal. It's not being weak, it's not being pathetic to feel anxious, it's completely understandable.
So when we feel anxious and our body is overwhelmed by some physical sensations that we might experience, when we actually feel we're in a threatening situation, we have a response, and our brain decides sort of what's going to be the safest for us in that situation. And the three responses that we typically, I suppose that the three responses that we typically see are to fight, to run away, or to freeze. Okay, and each of them responses are designed to keep us alive and what is safest for us. So it might be that there is a saber-toothed tiger running around, or we're attacked by maybe somebody else, or there's another tribe. It all comes back from when we were cavemen days. It might be that the safest response is to actually fight that threat. It might be to run away, but often it might be that we freeze, and we've got no control over these responses. It's whatever our brain decides is the most safest option. And freezing might be similar to what animals do, I suppose, where they play dead. And if that's going to keep us alive in that moment, that's what our brain will make how we will respond in that situation.
So, and the reason why it's important to be aware of that fight, flight, or freeze response is also known as our threat alert system. So as Rochelle says, back in caveman days, we would have this response, and that will keep us safe. And that's great when you're faced with a saber-toothed tiger. it's just not so helpful in the here and now when we don't have perhaps a literal threat in quite the same way, but we can still get that fight, flight or freeze response when we have a threat. So for example, if we're being told, okay, well, you need to come into the hospital for your 20-week scan, but obviously there's a pandemic on, so we might start to think, oh gosh, but is it safe for me to go into the hospital? Can I have my partner with me? That can make us feel really threatened. And it sets off that fight, flight or freeze response. So that's why it's really important to understand that when we feel threatened, and it doesn't have to be by an external threat, it could be by even going to the shops now can feel quite threatening. This is the response that's triggered. And we know it's triggered because of the way it affects us in our body. So we've got a whole bunch of different symptoms there, which probably be quite familiar to you.
Yeah, so when we're feeling anxious, we have this really overwhelming, uncomfortable feeling in our body. And it's often really hard to describe anxiety. But if we start to break it down a bit, we recognize quite a lot of the symptoms are quite physical. So we might notice that we become quite hot. We might notice that we begin to shake. We might notice that our chest feels really tight. We might notice that we might have urgency to need the toilet. We might feel a bit tingly or jelly legs or pain. We might notice sort of we're becoming a bit more dizzy. All these physical symptoms we experience can be really, feel quite threatening to us, but they're all a natural response of anxiety. And all of these physical symptoms we experience are a result of our threat brain trying to keep us alive. So what actually happens is our brain, our amygdala, which is our threat brain, always scanning for threat, will release some adrenaline into our bodies. And that adrenaline is going to enable us to either fight, freeze, or run away. Okay, so as a result of that adrenaline, what happens is that it's pumping the blood round to our body to enable us to get our core muscles running, where our chest might become tight because our breathing changes. We're taking in a lot of oxygen, trying to get that blood flowing through to our core muscles. So our breathing does change and become a little more rapid. We might notice we're a bit dizzy, and that's because we're taking in so much oxygen that we're not actually releasing the carbon dioxide in the way that we would normally when everything's a bit more rhythmic. So that can cause a bit of dizziness. Sort of the jelly legs, because all our blood's running round to our core muscle groups to enable us to fight or run away or freeze, that does cause a bit of jelliness, I suppose, and pins and needles. We sweat. We know that we sweat to enable us to cool down. So again, it's all part of that response. Urgency to need the toilet could be because we're effectively lightening the load when we're running away or fighting, but also it's because our digestive system temporarily shuts down. If we're in that threat response, we don't need to be digesting our lunch. We need to make sure that all the areas of our body that need to be put into action are being used most effectively. So that's sometimes why we can get that butterfly or churny tummy feeling, because our digestive system's temporarily shut down. So every physical symptom, as difficult and uncomfortable and as overwhelming it is, it's a response from that adrenaline in order to keep us safe.
And if we think about what might trigger it, there's a lovely acronym here. I did try to stay away from acronyms, but this one's quite useful, I feel. So anxiety is nuts. It is triggered by new situations, unpredictable situations, threats, or this lack of control, if we feel like we're not in control. And if you were to put being pregnant and the prospect of giving birth into that, well, that might be a new situation, even if you're not a first-time mum to be. Well, actually, it's still every birth is different. So it's a new situation. Birth is unpredictable. Pregnancy can be unpredictable. It can feel quite threatening. And of course, there's that lack of control there, particularly if there might be a lack of control of our body. I mean, it does its own thing during birth a lot of the time. And there might be a lack of control of, in terms of, well, I want to have this kind of birth, but I don't know if I'm able to anymore, and who's going to be there. So we can see how pregnancy and the prospect of giving birth can be very anxiety provoking, but equally in the context of a pandemic? Well, that's definitely a new situation. That's definitely unpredictable. It's hugely threatening, and we have a complete lack of control there. So no wonder we're feeling anxious. And I kind of gave you a little sneak preview of this because I think it was it's helpful when Rochelle was talking there about the amygdala, to just kind of give you a little bit of information about how the brain works. So the amygdala is what keeps us safe by alerting us to danger. So that is the bit of our brain which triggers the fight, flight, or freeze response, and that gets us ready to fight, to flight, or to freeze. That then communicates with our hippocampus, and that helps us to store and remember information. So it's a bit like a librarian. So it tags our memories with information about when and when they occurred. And then you've got this part of your brain here, the prefrontal cortex. So this is the rational part of our brain associated with making balanced decisions and problem solving. So what you might find is when we're feeling calm, so we're doing all right, we're feeling quite calm, we can think rationally. People say, oh, I when I'm calm or after the event, I can see now, rationally speaking, that actually maybe my brain was running away from me. Well, that's because when we are anxious, when we feel under threat, the amygdala's firing. It's firing, and they're not necessarily talking to the prefrontal cortex. It's not them, so we can respond quite emotionally, or we can end up processing information in a way where it's quite extreme. We can end up getting quite black and white thinking instead of thinking, okay, what's the risk here, or trying to think through things in the shade of grey. We can end up thinking, well, either it's do or die. So the point about, and the reason we wanted to show you this slide is to say, actually, well, what's the trouble with the brain? The fact that it's got these three different parts that need to talk to each other. Well, actually, the human brain is fabulous at trying to find solutions and to make things more certain by thinking about all the possible scenarios and focusing on things that aren't in our control, to try and think about how can I bring this into my control? How can I make this more certain? How can I try and get a grasp on this situation in order to feel less anxious, in order to be able to cope better? But the trouble with that is that it often leads to rumination. So that's when we go over and over negative thoughts in our heads. So we can say that rumination is to do with the past, perhaps, and then worrying, or in this case, catastrophizing, which is thinking the worst possible outcome is going to occur. And because our brain is responding in that way, we're ruminating or catastrophizing, that actually, in turn, increases anxiety. Ironically, even though we're trying to do it to try and reduce anxiety, it actually makes our anxiety worse, and that increased level of anxiety makes us feel less able to cope, which triggers more thoughts of, yeah, but what if this happens? What if that happens? Try and kind of make it more certain, which then makes us feel even more anxious, which makes us feel even less likely to cope. So we can see it's a vicious cycle, and you'll get very used to, if you come to sessions with us, you'll get us very used to us talking about that vicious cycles that we can get into. I kind of picture it as being a bit like stuck on a roundabout and not taking an exit. And our role is to help you help building those exits for you, so that when we get a bit stuck with ruminating or catastrophizing or focusing on the physical symptoms in our body which are uncomfortable, it gives us an alternative.
It's so interesting. You see it as a roundabout. I see it as almost like a cycle that we just then put a wedge in, so we can stop it spinning, going on, and how can we, change that moving forward. But yeah, it's funny, we perceive it slightly differently. But I suppose in order to just, the key learning points about anxiety is, one, it's completely normal, let alone it being, in the situation that we've got going on at the moment of COVID-19. There's a lot of uncertainty, but also we're bringing a human into the world in a pandemic. So of course that's really natural. But I suppose the one thing that's really important is, as difficult as anxiety is and as normal as it is, we don't ever want to remove that. Anxiety is there to keep us safe. Anxiety is that response that we get, that if we walk into a road and a car comes rushing around the corner, it's that anxiety, that response we get that helps us take that quick step back. So it's always there, designed to keep us safe. But what we're trying to do is is retrain it so it doesn't necessarily prop up in them sort of emotional situations.
So it's not so overwhelming, so it doesn't take over our lives, so we don't end up constantly catastrophizing and thinking the worst case scenario when we don't necessarily need to. I think, yeah, that's such a good point. It's about making it more proportionate. So what we also know, in line with the worrying and the catastrophizing, is that anxiety can generate a lot of these what if thoughts. So what if I can't get the birth I want? Am I going to get the birth I've planned? And this is pre-pandemic. So there could be a lot of anxieties going into the birth. So am I prepared enough? Am I going to be able to have access to the birth that I want? If I, for example, wanted a water birth, would I be able to get that? But then, of course, during this time, in this pandemic, we also have all of the other greatly anxiety-provoking things, such as, okay, so what's happening with my care? Am I going to be able to be seen face to face, or is it going to have to be virtually? Will I be able to have access to a water birth? Actually, is that going to be a facility still available to me? Am I allowed to have visitors after the birth? Will my partner be able to be there with me during the birth? What's going to happen with my antenatal appointments? Are they all over the phone now? Can I have a home birth? Do I have to go into hospital? All of these worries, and they can be really, really difficult to manage because they're very real. They're very real. A lot of what if thoughts, very real. So here's our first of our strategies. Now, just to say about all of the strategies that we're introducing. So we go into these in a lot greater detail in the sessions within our service, but we wanted just to kind of throw them out there for you, just as a technique you can already start to put into practice. And if you think, oh, I like the look of this, I want to know more, then there's some referral information at the end of this talk.
So one of the first techniques we look at when it comes to worry is sometimes when we're feeling that anxious, we can't see the wood through the trees. And I suppose it's really helpful to understand whether our worries are hypothetical or whether they're practical. And using this simple tool really helps you identify what sort of worry it is you're having, because we can respond to them worries in different ways. If your worry tends to start with a what if, it might be that it's hypothetical. And what we're looking to do is refocus our attention, and we go through so many disengagement techniques to be able to help you disengage from that worry, because what we know is worrying about it isn't going to change the outcome of that. Whereas if your worry is more of a practical problem, what we look at is how can we problem solve that? How can we put in a plan of action so that we're able to really sort of pinpoint what we're going to do about it, when we're going to do it, and then we've got nothing to worry about afterwards. So it's important that we schedule that in and then we disengage from that worry as well. So we go through 2 different techniques on how to manage these worries in very different ways.
Absolutely. So then when it comes to thinking about practical solutions to worries, so if it's a practical problem, so it may be that you have questions about your birth plan or the latest government guidance. So it's about contacting your midwife to talk this through. Just to say that we work really closely with the health visiting team and the midwifery team up at QA, and they're very keen for us to stress that they are there to support women. They are there, they are very much open, they are here, and that they are also they're myth busters as well. So if you've heard all sorts of things, all sorts of rumors circulates on social media, or I wasn't able to have this, or oh, I've heard you can't have that, your midwife should be able to answer those questions for you, because it's just to have that awareness, however, that obviously the government guidance is changing very, very frequently. So if you do have questions, I would urge you to contact your midwife to talk that through. There are also some practical things we can do to keep ourselves safe, such as implement the safety procedures, the hand washing, the social distancing, this idea of making sure that we stay in contact with family and friends where we can, signing up to virtual antenatal classes. So the good thing about being this far into the pandemic is that more and more things are becoming available online. So keep a lookout. Social media is really incredible tool that's really taken off in a big way to be able to support people. So there are things available.
Don't feel you have to miss out on these things. If you are feeling anxious about going out and mixing, don't feel you have to miss out. There's so many different access points to these services now. Everyone's trying to adapt it to make everyone as safe as possible. So whether virtual classes, whether it is having a telephone call, the services are there for you. So please be assured that, as Tamsin said, social media is such a great resource to be able to link in with these services as well.
And as it says there, connect with other expecting mums over social media if you're wanting to socialise with other pregnant women. So although it might be that certain things aren't running at the moment, that's not to say that will be forever. But keep checking, keep looking, there are various apps which are available to connect pregnant women, connect new mums, because we're all in this pandemic together. There was a lot of isolation. So what that does mean is that then, as a response to that, there is more online. So it's just to say that that's something that you can do practically to perhaps support some of these worries. So when it comes to reducing the hypothetical worries, a really, really key point is this idea of being informed, but not too informed. One of the really big buzzwords in CBT is balance. So sometimes people say, oh, I'm not into CBT because it's just all about positive thinking and that's not going to help me right now. Actually, that's a bit of a myth. CBT isn't about positive thinking. It is about balanced thinking. So, and as I say, when it comes to reducing hypothetical worries, this idea that obsessively checking news websites multiple times a day, it's likely to elevate our anxiety without actually gaining a lot of information. So if that is the case, it might be helpful to consider limiting yourself to only checking maybe once a day and only a single reputable news outlet. Otherwise, we can end up going down this rabbit hole of anxiety and then checking, and then there's another link to another article and it says about this and that says about that and that says, oh, there's this possibility and that this could happen, and then think, oh my gosh, but what about that? And you click on this and oh my word, you've lost an hour, our anxiety's through the roof, and we've got all of this stuff in our head that actually, do you know what, it's not helped us. So identify sources of information and resources that provide you with help, assistance, support and advice. So actually maybe put in a bit of a filter as to what we look at and think about how is this affecting me? Because actually if it's not giving you more information, it's only elevating your anxiety. How helpful is it for me to be reading these forums or these blogs or various other bits of information?
Most definitely. So what we want to do, and we go into a lot more detail about this within our sessions, but we know that anxiety does affect us physically. We've spoken a lot about that. So what we really want to do is there are some really helpful techniques and apps and resources that you can use. Mindfulness is particularly helpful to really help you ground yourself and bring yourself back into that sort of present moment, really focusing on sort of mindfulness techniques using your breath. There's also progressive muscle relaxation. Fantastic. There's fantastic videos on YouTube. You just type in PMR. It ranges from times of 5 minutes to 2 hours. And there's different types of music, but that's really focusing on sort of your muscles and relieving that tension from it. It can be a lovely thing to help you relax and go to sleep. My only suggestion is have a playthrough, see what works for you. Find a voice that doesn't grate on you, because you're not going to find it relaxing if you feel like you're clenching your fists every time that person speaks. So it's like that sat nav voice. Figure out what works for you. But yeah, muscle relaxation on YouTube, rhythmic breathing. The importance of actually trying to align our bodies back into its natural state. When we're feeling anxious, as we said, we notice that sort of we almost hyperventilate because we're not getting that balance of, there you go, CBT buzzword, not getting that balance of oxygen and carbon dioxide. So using some breathing techniques can be a really helpful way to relax in that moment, and also grounding techniques. So reconnect with your body, what's going on around you. What can you see? What can you hear? What can you taste? What can you touch? What can you smell? Because all the time that you're focusing on connecting with your body and bringing yourself into that present moment, your mind's not catastrophizing about what happens if this, or what if this happens. And it's also not ruminating, being back in the past where I must do this because this has happened to me in the past, therefore it probably will happen again in the future. So every time you're back in that present moment, it's like a muscle. You're training your mind to come back out of the past or come back from the future into that present moment.
Absolutely. And if you think that we're whizzing through this a bit too quickly, that's completely understandable, because what we're doing is we're hoping to pique your interest, so that if you're thinking, I want to learn more about that, we have entire courses on these things. You know, we offer mindfulness-based therapy, we offer cognitive therapy, we offer, you know, we'll go through a progressive muscle relaxation. We'll teach you soothing rhythm breathing and the grounding techniques. So we're just putting in there for you to be like, oh, this is something that might be interesting. I think I might want to learn more about that. So if that is something that you're interested in, then give us a call and let us do an assessment and talk you through what our options are.
Definitely.
The other thing to do in order to try and help manage with this anxiety is to try and act in line with your values. So it's not a perinatal specific resource, but I would urge, if you are struggling with anxiety and worries around COVID, this idea of acting in line with your values is taken from Dr. Russ Harris' Face COVID series. Absolutely brilliant. So that's a resource you can check out. It's free online. So this idea of what we mean by acting in line with our values. So it's when we are physically unable to do so much that is important to us at the moment. So we might not be able to go and see loved ones. We might not be able to meet up with a group of friends. We might not be able to go to a mum and baby group. We might not be able to go to an antenatal class. We might not be able to go to Aquanatal. We might not be able to do all of those things. So take a moment, consider, what are my values? So what kind of a person do I want to be? Do I want to be honest and caring and kind and compassionate, brave, humour, patient? And how do I want to treat other people, and how might I then treat myself? So if we're beating ourselves up because we seem really plagued by worries and I just can't overcome it, well, actually, what would you say to your friends who was going through the same? So remember that self-kindness is essential if you want to be able to cope well, especially if you're in a caregiver role. So you might be pregnant, but you might also have another little one or a bigger one, you know, to look after. So actually, if you want to feel able to cope with your anxiety, give yourself a break. Give yourself a break. And I think that links in with this next one here about prioritizing our own needs. So there's a little analogy. I know, I was going to say, I'm sure Rochelle will back me up when we say that. We therapists love an analogy, love it. So yeah, you'll get very used to us saying, it's like this, because it just makes things a little bit more easy to relate to.
Yeah.
So yeah, oxygen mask analogy. So if you're, you may have had this one before. So if you're in a plane and the plane goes too high, there's not enough oxygen, the oxygen mask will come down from the roof. And the advice is you must put your own oxygen mask on first before you put it on anybody else, before you even put it on your own child. And the reason for that is because if I am senseless on the ground because I haven't been able to put my oxygen mask on, then how on earth am I going to be able to help that child or help my loved one? So this idea that if we want to be able to attend to others' needs, if we want to be able to be the best parent we can be, if we want to be able to be the best partner we could be, the best friend, the best daughter, the best whatever, we need to attend to our needs first. We need to prioritize these needs. So if we are feeling happier and calmer in ourselves, then we can then give it back to somebody else. So that idea of not being able to pour from an empty cup, another analogy, we can't pour from an empty cup. So it's the idea of thinking, okay, so what are my needs right now? Do I need to allow myself some downtime? Do I need to have a bit of a pamper? Watch Netflix? If it's a Skype session with a friend, what are my needs right now? And how can I get them met? And as it says there, if someone I love was going through this, and if I wanted to be kind and caring towards them, how would I behave? What would I do? What would I say?
So remember, guys, unless we're looking after ourselves, how are we supposed to look after anybody else? That's really important, that we are at the top there looking after ourselves before we can commit or look after anybody else.
If that sounds hard, you're not alone in thinking that. I've been working in this field for years now. What did I say, Rochelle? Like 8 years or something?
Yeah,
I've been working in this field.
Yeah.
And it's the biggest barrier I come across with new mums or mums to be, is that somehow we feel very guilty. That mum guilt is so powerful. That kind of like, if somehow I prioritize my needs, it's at the expense of everybody else's. Not so. But it might be a process. It might be a process trying to kind of revisit that and overcome that. And if that's the case, then again, that's what we're here for. If you're thinking, I'm finding that really hard, and I don't know what that looks like, I don't know practically, what does that mean? What does that look like in my day-to-day life? We're here. Refer to us. We can talk you through that.
So yeah, I suppose we're coming to the end of this now. So the key messages that hopefully you've taken from just listening to this workshop is that anxiety is completely normal, particularly of what we're going through. It's completely understandable that we're in a pandemic at the moment. That anxiety is going to be there. It is overwhelming, but it's completely normal to experience that. As we said, new situations, uncertainty, and that really drives anxiety. And we know that worrying, that can be almost crippling and creeps into day-to-day life, where worry just takes over, and that's all part of anxiety itself. We've looked at ways that we can manage anxiety, I suppose, and the worrying specifically, if we're able to identify whether our worries are hypothetical, if they're practical. We know that practical ones we can problem solve, how we're going to really tackle that problem, that worry. But if they're hypothetical, then what we want to do is really look at disengagement techniques and refocus our attention. As I said, bringing our mind from the future, or then what ifs, into that present moment. And we know that the news and all social media and different links and certain things can really feed into our anxiety. So what we're looking at is keep yourself up to date. That's really important with what's going on. Keep yourself up to date with the guidelines, but don't be too informed that it is going to drive your anxiety more into overdrive. We've got enough going on. It's we're bringing humans into the world, so don't be hard on yourself. Just stick to what you feel comfortable with. Keep informed, but not too informed. And we know that when our anxiety is really in that overdrive, really use some of them techniques we spoke about, them grounding techniques, focusing on your senses, reconnect with your body. YouTube progressive muscle relaxation, or some relaxation techniques. And hopefully that will really help realign your body back into sort of where it stands when it's in that sort of normal response, as opposed to sort of that anxiety driven response. It's important that we act in line with our values as well, and we prioritize our needs. So there's loads of resources available, and I think we're going to speak about where we can find some really helpful ones in the meantime, and then what you can do to refer to our service, or re-refer if you've used us in the past.
Absolutely. So next step, Talking Change offers support to women within the perinatal period. So by perinatal, we mean that covers the antenatal, which is during pregnancy, postnatal, which is after pregnancy or post-birth. So perinatal covers ante and post, so perinatal period. Prior to COVID, we were visiting local family centres. So this is all now moved online. So we still do initial assessments. We still do a perinatal support group. So that's for women who are So that's actually for women who are in the postnatal period and struggling with low mood or anxiety after birth of their child. We're running this antenatal anxiety workshop, and our hope is in the future, if there's enough interest in this, we might be able to offer it as a standalone course, as a series of sessions, so that we can offer these strategies we've talked about in greater detail. We absolutely accept self-referrals, very much so, but we also accept referrals made by health visitors and midwives. So as I said, we work really, really closely with the midwifery team, and we work really closely with the health visiting team as well. You can self-refer on 0300 123 3934. You can have that self-referral online. We also accept referrals from GPs and other health professionals. So if you are a individual in the community or somebody who works within the third sector, you can refer people in as well. So there's a referral form on our website, which is for individuals to refer themselves, but also for health professionals to refer. All that we ask is, if you do want to refer on behalf of somebody else, is that you get that consent to do so. There's loads of resources on our website. We recently rebooted it a couple of months ago, and it's glorious. There's so much stuff on there, so I would really recommend that you check it out. We also, as I say, when we are in sessions, we can talk through different resources. We're very skilled in signposting, and we pride ourselves in being up to date with thinking, okay, so what should be available? Where can you get further support at the moment? Just to say, when it comes to Google, because I appreciate we've talked about you know, you can Google this, but then don't Google certain things. So something like progressive muscle relaxation, you can't really get wrong. You can't really do it wrong. So that's a great technique to Google. And there might be other things which actually, where we're saying, might want to just steer away from certain websites. So it might be things, it might be about, when I say reputable news websites, or when you want factual medical information, it's about looking for the NHS logos, making sure it's an NHS provided service, or something that's got IS, which is information standards, to make sure that you're getting proper good quality information there as well.
And just to, on the back of that, we've also, Talking Change itself has a really fantastic Facebook group, Facebook page with lots of resources on there, lots of links. So that's a really great resource for you. And we've recently just created a YouTube channel as well, Talking Change. So feel free to follow that for any sort of interesting links, or if you want to explore that, look at past workshops that we may have done, and hopefully this one will be uploaded on its own.
Exactly. And I think we're also on Instagram and Twitter as well, which is super exciting. I don't think I'm on Twitter even, so yeah, it's really progressive. It's brilliant. So all that remains is to say thank you so much for listening to this workshop. We hope it's been helpful. Do refer if you think our service would be of help to you. We cover anyone registered with PO1 to PO6 GP postcodes, and anybody over the age of 16. And it's just to say, although this has been for women who are currently pregnant, we also support anybody who might be involved in your care. So partners, grandparents, siblings, friends, anybody, we're here to support you. So thank you so much for listening, and we wish you all the very best for the rest of your pregnancy.
Yeah, thank you for listening, guys. Bye.
Bye.